Hi, my name is Jason Osborne, Director of Emergency Management for Harrington Hospital. Today we're going to go over our PAPR units, which are the powered air purifying respirator systems that we are using here at Harrington Hospital. Our emergency departments and our urgent care departments will be using the 3M VersaFlow 600 unit, which we're going to go over in just a few minutes. And our medical surgical, OR, and ICUs will be using the Bullard EVA PAPR units. And we're going to show you and walk you through each of these different units. We're going to start with the Bullard. All of the Bullard units now are in a bag with a number and a seal tag. This seal tag is only there for when we do our monthly checks. Our emergency management team will be going around monthly to inspect them and to run them and to make sure that they are functioning appropriately. The only reason for that safety tag is that we know to change the filter. We are currently changing the filters every 30 days amidst this COVID crisis. Typically they have us change it when it's dirty or it's had a lot of use, but we've decided as a hospital we are going to be changing them every 30 days. If this tag is intact when we go to take off and to check the unit, then we will not replace the filter because that will indicate that the filter was not used. And at the end of the 30 days, if the is open, we will replace that filter as well as doing our normal monthly test. So if you're ready to use this particular model, you can just pull the safety tag off and open up the bag. In this bag, you will find a unit, a PAPR unit. This is the EVA PAPR, this is the filter here. You will find your tubes already connected. What you're going to want to do is just make sure that this connection is tight. The battery will be on a separate charger. And as a newer unit, these batteries are kind of stiff to go in there, so you want to make sure it's really in there. So the battery goes in just like this. There's contacts here and contacts here. So you're going to push that battery in and give it a good to make sure you hear that click. You can also push the button here, which will tell you that the PAPR battery is now full. This battery should last approximately 8 to 10 hours. It has a belt system, which you can put around your waist. And it will take a little bit to adjust it. This tubing here will go to a mask. Now I suggest that you have a buddy help you, but you would connect this. There are two notches on the side here. You connect this into here and give it a twist so that it locks in. Now if you wear glasses, you can put this on with the glasses. Know that you may have to adjust them. You're going to do this in a clean area prior to entering into a COVID room or a room. This mask goes in over your head, and you take your thumb and just bring this seal around. So this unit is now ready to go. I will put this around my back, okay, and adjust the straps appropriately. Now, this particular unit has a on button that is a touch pressure sensitive. It's not something that's going to click, but you want to push and hold for 2 seconds. You're going to hear a beep. It's automatically going to start on the high power, okay? And at this point, you want to make sure and get that seal to make sure that there is a good seal all the way around, okay? You may feel air coming out the sides or the bottom. That's completely okay. Again, that's positive pressure that's going to push that air out. Now, if you push and hold the button for 2 seconds, you're going to go to a lower power. And if you push and hold for 4 seconds, it's going to turn off. Okay? When you're taking this unit off and it's on, you're going to have it around your back. Same thing as we talked about before. When you take it off, you're going to want to take it off with your gloved hands slowly and away from your body, and then you're going to set it down on the dirty area when you're doffing your equipment. When we're done with any of your wipes, peroxide or alcohol based, and then let them completely dry. And this hood, you're going to want to write your name on it, and this will be your hood. We will replace them if they get dirty, soiled, or damaged in any way. We have here at Harrington Hospital enough hoods to provide you with what you need. For right now, again, we're still going to wipe them down, use conservative measures, but we have an abundance number of hoods than we had prior during this COVID event. Each bag will have 3 masts in it. It'll have a large, a small, and a medium. So once you know what size mask you are, if you could let us know, and we will make sure that there are plenty of extra masks available for you. These are color coded, so it's easy to recognize. So your mediums are going to be a blue connector, your larges are going to be a black connector, and your smalls are going to be a green connector. If you have any questions at any time, you can reach out to the Emergency Management Department, myself directly, or Craig at extension 5041, and we would be happy to answer any questions that you may have. Okay. So now we're going to talk about our 3M VersaFlow 600. This particular unit is being used in our emergency departments, both here and at the Webster campus. There are 4 of these units in each ER. Currently, because of construction, 2 of the units are in the triage area in the Southbridge campus, and the other 2 units are in the ER director's office. In addition, there is one of these units at the Oxford Urgent Care Center, and Craig will be coming by this week to show you some specifics on this, but this video is meant to augment that training. The Webster campus also has 4 of these units that will be in the department as well. Again, they're sealed, and again, the seal is only there for, so if it's every month when we check these will be inspected every 30 days for flow, battery life, and everything else. If the seal is broken, we will then change the filter. If the seal is not broken, we will still conduct the normal test. However, we will not change the filter at that time. Once we take that off, Velcro, this opens up. Okay, this is a little bit different unit. Okay, it's a little more slender. The filter is back here. It still has the same belt loop. All the masks come with this hazy type film. So some people may ask, say, hey, it's kind of blurry, I can't really see. You're going to want to take this film off. It comes off pretty easily. It may not come off in one nice, clean sheet, but you're going to want to make sure you take that off. Otherwise, you're going to get kind of a hazy view, and you don't want to do that. You want to see clearly what you're doing with your patients. This kit comes with, again, different size masks. There is a large, medium, and a medium small. There are 2 sizes. So pick whichever one you think is most effective for you. And again, we have plenty of these hoods now. We still are going to wipe them down individually, but if people want to use them, even though they're not PAPR only, they may. Okay? This particular machine has a couple more functions to think about. Is we're going to turn it on by this power button right here, and we're going to make sure that we install the battery first. Okay, it's a slender battery. It's going to be on a charger separately. The contacts will line up and will click right into place. Once I have this, I can turn it on. The blue power button here. When you initially turn it on, it's going to start the airflow, and it's also going to do a warm-up sequence. And it's going to go through a self-check. All the lights will flash, as you can kind of see. It'll vibrate and let you know that it's ready to go. This particular model has 3 functions. It starts on the lowest setting. Okay, if you push and hold this blue button with a fan on it, it will increase the flow. Push it once and hold, push it twice and hold, and you'll get your maximum airflow. This is what's most comfortable for most people, the maximum airflow. But you do not have to. You can use the lowest airflow, whatever you feel most comfortable with. This bars here are to tell your flow, and these bars here to tell your battery. Okay? Both units, if the flow is restricted for any reason, okay, I'm going to actually restrict this flow, and you're going to kind of see those bars go down if there's any problems, and eventually it'll start beeping at you when it can't flow anymore. As soon as flow is restored, you will see the lines coming right back up. It'll take us a couple seconds to recalibrate itself. and then you're going to be back and ready to go. So this unit here, a little bit different with the connector. All the connectors on these are white. Okay, this would just click in until it clicks, and I would just make sure you have a secure fit. Okay, again, goes over your head and around your face, makes it a lot more comfortable and easier than the other double bib hazmat hoods. You're going to put this around your back and tighten it up, and you can put your gown, gloves, and the rest of your PPE on over this. Again, you may feel some air leaking out the sides. That's okay because it's positive pressure air, so air is coming in and being forced out. So you're not going to be, you're breathing filtered air. You're not going to be breathing any of the room air that's not filtered. And because it's positive pressure, it's pushing air out, not bringing air back in. So you will notice there are small holes at the bottom of these. The other one, you'll notice that there's some small holes. Here it's more of a fabric. It is very breathable. It's very easy to maneuver in. And one of the largest and the best features with these is you can actually put a set of stethoscopes in your ears and do a full assessment on a patient where we had difficulty prior. Same thing with this one. You can put your stethoscope in your ears. This is what they call a half-face piece, and it's been found to work. Everybody we've talked to that have used it thus far has had raving reviews and say it's a lot easier and easier to use. When you're done, again, when you're doffing your PPE, the biggest thing is to take it from the back, okay, move it away from your body, and place it down. Preferably to have somebody help you, as we've talked about in other training, and somebody can get the PAPR unit and take it and wipe it down. The PAPR unit can be wiped down, as well as the hood, and now this hood can be yours. You're going to write your name on it, and this is now your hood. You'll notice that it has a nice comfortable headband that will actually absorb a little bit of sweat, so that will help as well. If there are any questions about any of these units, whether the Bullard or the 3M, please feel free to contact us at 5041, the Emergency Management Department, and we'll be happy to answer any question that you have. Okay? One thing I do want to just reinforce is that with the Bullard unit, the button again is not a push button like the 3M. It is more of a touch pressure sensitive. So when you push it and hold, initially you're going to turn on for a couple seconds, and then when you push and hold for 2 seconds, it'll go to low power, and remember you have to push and hold for 4 seconds in order for the unit to turn off, okay? And you'll hear that beep. If at any point in time you hear a beeping noise while you're using it from the Bullard machine, or a beeping and a vibration noise from the 3M, that's telling you that there's a problem with the unit, whether it be the battery or the airflow, and at that point in time, you should get out of that room as quickly as possible. Now, these are brand new units, so we really shouldn't have that issue, but just so you do know that if it does happen, you need to get out of the environment, and we'll check this as a minute. If there's any problems with these, you're going to contact me directly at 5041. Biomed is not handling these at the moment, so we will handle them directly, and we will consult with Biomed as necessary. So please feel free to reach out to us at any time, and we'll be happy to go over and do specific training with you if you require it. Thank you all so much, and thank you for your continued efforts throughout this entire event. Have a great day and stay safe.